Welcome back to the deep dive. Okay, let's talk about something I know is probably a major headache for you, prior authorizations.
Oh, yeah. Definitely a source of, let's call it friction.
Right, that endless paperwork, the delays, it just eats up so much time. But there's actually some potentially big news brewing. A new commitment from, well, a lot of major insurers.
And that's the key point. It's not just one or two. We're talking over 40 companies here, pooled together under AHIP, the Blue Cross Blue Shield Association. It's a pretty massive group.
Huge, covers something like 257 million people across all sorts of plans.
Exactly. Employee benefits, individual market, Medicare, Medicaid. It's broad.
So today, we want to really, unpack what they're actually promising. What are the details, and what could this genuinely mean for you day to day in your practice? Because promises are one thing.
Delivery is another. Always is.
Okay, so the headline grabber, UnitedHealth, Elevance, Aetna, Cigna. 48 companies in total pledging to streamline prior auths.
Yeah, and they've laid out some specifics. They're talking about actually reducing the number of things needing prior auth. That's big.
Reducing requirements. That would be welcome.
Absolutely. Plus speeding up responses, trying to standardize the electronic side of things, less portal hopping, hopefully, and being more transparent about why things get approved or denied.
Okay, what about timelines? When might you actually see any changes?
Well, they're staging it. By 2026, the plan is to cancel some rules, improve how they communicate, and this is interesting, honor prior auths from a previous insurer for 90 days. Helps with continuity of care.
That 90-day thing could be useful. Avoids those immediate gaps when a patient switches plans.
Right. Then, looking out to 2027, that's when they aim to adopt a common tech standard for processing these things electronically. And get this, respond to 80% of electronic requests in real time.
80% real time.
Then,
That sounds almost too good to be true, given the current state.
it's ambitious, for sure. The idea of moving towards one sort of digital pathway instead of juggling dozens, that's the goal.
So why now? After all the years of frustration and calls for change, why this coordinated push right now? What are the insurers saying?
Well, the official line from groups like AHIP is about tackling the fragmented system, modernizing, reducing frustration for everyone, patients and providers. Streamlining.
But they still argue prior auth is necessary, right?
Oh, right.
To control costs, prevent unnecessary treatments.
Oh, absolutely. They maintain it's crucial for cost containment. And they often point fingers back, saying denials happen because providers, leave out key information on the forms.
The missing information argument. We hear that a lot.
We do. And from the provider side, you hear about the sheer explosion in requests, rising denial rates, and frustration with things like AI reviews potentially lacking nuance. The AHA calls it excessive and overly burdensome, creating barriers to care and contributing to burnout.
That burnout point is crucial. So this claim about missing information, is it just deflection, or is there something practices can do to kind of bulletproof their submissions?
It's probably a bit of both, realistically. The burden is undeniable, but this is where having really solid internal processes or even partnering with, say, a dedicated human medical billing company can make a difference.
How so?
Well, a good partner understands the intricate requirements of each payer. They can help ensure submissions are complete, accurate, formatted correctly, essentially minimizing those easy reasons for a rejection. It frees you up from chasing paperwork.
Right, letting you focus on the patient, not the pre-auth form. Makes sense. Still, there's got to be some skepticism, yeah. Provider groups must be wary.
Definitely. The MGMA, for example, points out they've heard similar promises before, like back in 2018, and prior auth still tops their list of administrative burdens. So the question is, what makes this time different?
Is anything different?
Actually, yes. And this is key. Some of these pledges, they're basically becoming mandatory anyway, thanks to CMS regulations.
So regulations are forcing their hand on some of this.
To an extent, yes. That common text standard for electronic prior auth, for instance, that's already mandated for government health plans by 2027. So this isn't all just, voluntary goodwill. There's regulatory pressure involved.
Interesting. So it's a mix of provider pressure, regulatory deadlines, anything else factoring into the timing.
I think we also have to acknowledge the increased focus on relationships, provider and member relationships, particularly since late last year. The tragic death of the UnitedHealthcare CEO in December really intensified the conversation around easing tensions and improving interactions.
Right. That event certainly seemed to underscore the need for bridge building. It feels like a convergence of factors pushing this forward.
Exactly. A confluence of pressure, regulation, and perhaps a renewed focus on collaboration. But again, the proof will be in the pudding. Will these changes actually translate into tangible relief for you on the front lines?
We've seen pledges fizzle before.
We have. So while it's a positive step on paper, the real test is implementation and whether that day-to-day experience truly improves.
So the final thought for you to chew on. What does this actually mean for your practice in the coming years? With these changes rolling out through 2026 and 2027, how might you start adapting now? Can you leverage these potential improvements or maybe anticipate some new challenges along the way?
Something to consider.
Definitely. Keep thinking on that. Thanks for tuning in to The Deep Dive.